So my name is Tim Adams. I'm the nurse coordinator for Palliative Care for Tanner Health System, and I was asked to explain the differences between hospice and palliative care. There's a lot of medical providers that don't understand this distinction, but hospice represents a goal change where the patient and the family want to focus solely on comfort, and they don't want aggressive treatments, interventions, diagnostics, chemo, radiation, etc. They want to focus just on the quality of life and making the patient comfortable. And hospice frequently manages physical symptoms, be that pain, nausea, vomiting, diarrhea, constipation, agitation, anxiety, shortness of breath, sleeplessness. All of those symptoms are something they try to manage. And usually families choose hospice when they've kind of run out of options or the quality of their life is not benefited by the treatments we're still offering. And so if our treatments at the hospital don't make them feel better or only prolong their poor quality of life, then they're considering let's just focus on my comfort instead. Hospice is covered by Medicare benefit and is kind of defined by Medicare as if a disease process has 6 months or less life expectancy, then the patient qualifies for hospice in the home setting. But hospice represents a goal change where the patient says, I just want to focus on my comfort and my quality of life. Non-hospice palliative care is the consult service that we're offering in Carrollton and Villa Rica, and that does not represent a goal change. We help patients and families navigate complex medical situations and decision making. Do they want a PEG tube or an artificial feeding tube or chemo, radiation, etc. for their loved one, or do they not? And a lot of times they have an advanced directive, a living will, and we try to help bring that to the table, discuss that with the families and the physicians, and where would the patient want to go from here with their decision makers. We do not represent a goal change. We represent how do you navigate the complexity of the situation you're in. And so we have a doctor, a nurse, and a social worker, and we try to help the patient and the family get complete education so that what decisions they do make, they're making with their eyes wide open, so to speak, that they're able to understand why the doctors are recommending these different things and what it would mean to them after they make the decision. And so that way they go through the decision process a little better. None of it's fun, none of it's easy, but if you go in with more education, you do a better job. Education is, it's equipping them with power when they have education. And so our consult service is only in the hospital setting. We don't represent a goal change. We represent how do you navigate this and try to equip and help with education and understanding it. We do some physical symptom management if the patient doesn't meet inpatient hospice criteria and they're dying in the hospital. We can do the same physical symptom management that hospice does. They're just better known for it than we are.